Sue Smith sitting in for Aaron Rand, and it's great being with you here this week and next. And we're talking about ER doctors right now because there's a new study painting a grim portrait of life in Canada's emergency rooms. The study was published in the Canadian Medical Association Journal, and it found that about 10% of doctors are leaving the specialty because of burnout. Dr. Kerstin de Wit is an emergency physician and a professor at the Department of Emergency Medicine at Queen's University. She's also the study's lead author, and she joins us on the line. Good afternoon.
Good afternoon.
So, Dr. de Wit, what did you hear from other physicians about their working conditions?
We felt that physicians felt they were carrying the burden of the broken healthcare system. They said there was an ever-increasing workload when they went in to do their shifts, and the care that they were providing was deteriorating, and they felt that there was no end to that the care would continue to deteriorate.
Mm-hmm. And does that, what about you personally? Does that strike a chord with you?
Yes, it does. I've seen many changes in my own work life in the last decade, and the biggest change is the overcrowding that we're seeing in the emergency department.
Mm-hmm. So, I mean, I think we all have a feeling about what burnout means, but what does it mean in this context? What are the doctors actually feeling?
Well, there were two dimensions that we measured to define burnout, and that was emotional exhaustion, which was a very common theme where people said they were absolutely exhausted. And the second was depersonalization, where people feel a lack of empathy or sympathy for others. Mm-hmm. And we found both of those symptoms were very common. Mm-hmm. And physicians were trying to adapt the way they approached their shifts in order to allow them to return every day to work another shift.
Wow.
So some of them were becoming more detached, and many of them had accepted the poor standards of care because they had simply given up trying to advocate.
And so, I want to get back to that. It's obviously extremely sobering. But just tell me about this 10% that say they're leaving. What does that mean? Are they changing specialties, or are they leaving medicine altogether?
Yeah, there were three groups within that 10%. Some people retired. Some people changed to a different medical specialty and left emergency medicine altogether. And the third group left medicine and are no longer practicing as a physician. Mm. And of course, the latter two groups are a real tragedy because those are people who've had investment in their training, who are probably experts in their field, and they're a loss to the profession.
And is this, do you think, I imagine that there are really specifics to emergency medicine, but are you hearing this from other specialties as well?
I am hearing from other specialties that they are very tired and burnt out. But I think the difference in emergency medicine is that we have no way to protect ourselves from more patients. So we have no control over who walks in the door. Right. So other specialties have a degree of control in that they can control the number, for example, of patients who are seen in a clinic or who are admitted to a ward. And what is happening, in fact, is the patients who have already been seen by emergency physicians and are admitted into wards are actually backed up in the emergency department, and they're taking up the emergency department beds and the space in the emergency department, meaning the emergency nurses and physicians don't have their own department to see their patients, and the emergency patients in the waiting room are seen in corridors, on chairs, and unfortunately sometimes also in the waiting room.
I can tell you I have firsthand experience with that in the ER here in Montreal. Are there, I'm not as a physician, obviously, are there some provinces that are worse than others?
We haven't done a specific analysis comparing specific provinces, but the message was loud and clear, and we didn't hear a mix of messages. We only heard this one same message, that physicians are exhausted and that the wait times are out of control.
Okay, so what are, I know you didn't look at this, but from your expertise, are there any solutions? Like, are there short-term fixes?
Emergency physicians are, by essence, very resilient, and we're problem solvers. And every department has tried everything they can think of to try and change the way they manage patients, the way patients flow through the department. They've tried every short-term fix that's possible, and it's nowhere near enough. So I don't think there's any quick fix here. And in fact, the Canadian Association of Emergency Physicians have published a report online called EM Power, which does give recommendations of things that governments and hospitals could do to address this backlog of patients in the emergency department to try and reduce the overcrowding.
And what are some of those things?
Well, they are much, much bigger things to do with how governments hold hospitals accountable, how they measure the problem, and also bigger picture things to do with increasing number of beds within hospitals, and then ultimately increasing the community care that we have, both for older adults who live at home and the number of long-term care beds.
I mean, that strikes me as really being the crux of the problem, because you say, you know, basically the biggest change that you've seen in the thing that ER doctors have no control over is the number of patients coming in. Well, why are so many patients coming in, right? It's because of that, because the community care is not there, or you know, here in Quebec, the CLSCs aren't doing what they used to do. It's impossible to find a GP. And so what do you do if something happens? You go to the ER, and I'm guessing we're seeing that across the country.
Yes, and in fact, it's not really clear that the number of attendances have increased, and in fact, they may be decreasing at the moment because of the poor care that we're giving. It's more the mixture of the complexity, because our population is much older and sicker, and also this overcrowding where we have the backup of patients into the emergency department, and the emergency department loses the space that they own.
I feel like this is a message that we've been hearing for a while from doctors. I mean, obviously, it's interesting to do a survey like this and publish a study which really backs it up with numbers. But I feel like doctors have been sounding this bell for a long time. Do you see any kind of political will to change it? Because, of course, the problem is that it would be, you know, province to province.
Yes, I think we have to wait to see. I think every extra piece of evidence that comes out is helpful to try and put pressure on the government. I think we have to wait and see what the solutions are going to be.
And I wonder, from your point of view, I mean, you're also an educator. You're in the ER department at Queen's. You have young people who want to get into the profession. What are you saying to them?
Well, we're educating residents and medical students on every one of our shifts, in fact. So they're fully aware of the situation because they're working at our side every day and every night. So they're already seeing what's going on. And, you know, unfortunately, sometimes we have to say this is not the way you should do things. But unfortunately, this is the way we have to do it tonight, which is very, very sad and heartbreaking. And
like, I mean, how is this going to affect ERs going forward? Because it strikes me as perhaps with these kinds of studies, less people will go into ER medicine.
Yes, and that's possible. And we have already potentially seen fewer applications to residency training in emergency medicine. Time will tell, and it depends what measures are put into effect to change the situation and to improve work conditions.
But, you know, a lot of the times people say, well, we can't just throw money at the problem. I mean, is it money that's required, or sounds like it's a rejigging of the way the system works?
Probably a bit of both, but you're right. It's going to take a lot of money.
All right. We'll leave it there. Thank you so much.
Thanks so much.
You've heard the chaos. Now you can see it. Hello. Oh my God. Watch all your favorite podcasts from start to finish right inside the free iHeartRadio app.
Gets the blood going, huh?
Catch every laugh and eye roll on shows like the Tom Green Farmcast and Park the Bus. Now with full video.
We're building a ramp for Tony Hawk.
It's the same hosts and the same chemistry with all the hilarious moments you've been missing right on your screen.
Cheers.
Open the free iHeartRadio app, search video podcasts, and tap watch.